Hey, it's Jessica DaMassa with WTF Health. I'm here at AHIP's Consumer Experience and Digital Health Forum, and joining me right now I have Patricia Forts. She's the Deputy Chief for Innovation and Strategy at Harvard Pilgrim Health Care. Patricia, good to have you here.
Great to be here, Jessica. Thank you.
We love to talk to health systems about how they are doing innovation, or big payers, and how they are tackling, like, bringing in new startup companies and bringing in innovation throughout the organization. So give me a little bit of an update about what you guys are working on as it stands right now these days.
Sure. We launched our Center for Innovation about 2 years ago, 3 years ago, and we currently are piloting about 6 to 8 startup, new entrants, emerging technology solutions within our organization. And by pilot, I mean we're offering them either to a limited segment of our audience, or we're offering them for a short term. So it's to really see and understand how the solution is going to be adopted, whether it's going to have the return on investment we're expecting, and the return on investment can be either reduced cost, enhanced member engagement, improved quality, or all three, ideally.
Okay, cool. So, I mean, I have a lot of startups that will watch, and they're always looking to do pilots. So, do you have some criteria that you have established within the organization about the pilots that you guys work with? Do you need to see them having had already piloted with somebody else? Like, tell me a little bit about what you look for.
So we have two buckets that the pilots might fit into. One is the startup, and we don't want to do too early stage startups, so we'd like them to have some proven formula that they've either had a client or a study, a national clinical study done to really verify and attest to the results that they're promising.
Sure.
So we will work with an early stage startup as long as there's some method,
validation, right? Okay.
And then we'll also work with new vendors that have been in the market. In that case, we really like to see them with a known client base with recurring revenue, and we put them through what we call our value and viability model.
Okay.
To test
What
out.
is that value and viability model?
We look at, are they addressing the specific areas or topics of interest that have been identified for us? So we have a clinical innovation team that brings to us what their pain points are.
Okay, great.
Are they directly addressing a known pain point? Are they, as I said, do they meet the threshold for revenue? Do they meet the threshold for customer base? So it's a quick model that we use to make sure that, they're at a place we want them to be, well enough established that we're comfortable offering them to our consumers.
Give us a little bit of visibility in how you establish those, like, strategic areas of, like, focus. So you said you have the clinical team that brings stuff to you. Are there others that are bringing stuff to you, or are you looking at the market for trends? Like, how are you finding the things that you're, everything, yes.
All of the above. The best resources that I have within the organization, we have the clinical innovation team, so it's our chief medical officer, a couple of his medical directors, and other folks on their team, and they bring some of their known pain points to us on the medical cost side, medical care side. We also work very closely with our sales team and really want to make sure that we're bringing solutions to the market that their customers, our clients, are going to be pleased with, and they're going to directly address problems or pain points that they've established. And we also work with the startup community, so occasionally we'll work with startups that aren't necessarily fitting into a category that we've defined, but it's something that we think down the road, based on market research and other trends that we're seeing, this is a startup that has a solution that we haven't even thought of yet. So it's a newer novel. The only other thing I'll mention, so I mentioned the clinical innovation and the sales, we also have what we call a client innovation advisory panel, and that's been the biggest surprise for us because...
What is that? Who's on that? What do you mean by client? How are you defining client?
I've handpicked some employers that are actual clients. Our sales team recommended them. There are larger employers, either self-funded or fully insured, so we have a pretty good representation. And we bring them to us and we say, what's happening? What are your employees asking for? What are you struggling with? What issues would you like to see innovation tackling or addressing for you? And we get great conversation, great dialogue. And it's also a chance for us to talk to them about some of the ideas that we're testing or vetting, some of the vendors we're looking at.
What do you think is the most challenging part of doing innovation in an organization like yours?
The challenge that I face quite often is just the challenge for internal resources.
Like money?
Money and people. So money, yes, we have a budget. We're always revisiting the budget. There's a lot that we want to do, and it's not a budget that can accommodate as much as we'd love to handle.
It never is.
Right. And then the internal constraints. People are really busy. People are working very, very hard. They are already resource constrained. So, in comes the innovation team with the next great idea and asking them to take on a little bit more or take ownership of something that we've piloted and now want to move on to their plates. And it's a challenge.
Yeah.
It's a challenge.
Any tips for overcoming that?
Build relationships.
Okay.
Make them part of your decision.
And the internal team.
process.
Yeah,
In the
okay.
internal team. Bring them in early, bring them in often, make them part of the vetting and evaluation, and so that they know that, yes, this is something I'm excited about. I see it as a solution that's going to benefit the organization and our membership, our clients, and I want to be a part of it.
Patricia, thanks so much for joining us. It's always a pleasure to hear how different organizations, especially some of your size, are tackling innovation.
Great.
Thank you so much.
Thanks.
I'm Jessica DaMassa with WTF Health. Thanks for joining us.